Hi, it's Katie again. This is my second video. This video is going to be about my journey with interstitial cystitis. It's the first chronic illness that I was diagnosed with, and that was about 15 years ago. I just got out of the shower, so I'm exhausted, and I'm sure I look a little peaked because I feel like crap now. I don't know about the rest of you people with fibromyalgia, but when I shower, just having that warm water change, my internal body temperature, I get a vasovagal response and I get dizzy and I get really sick to my stomach. So that's why I'm looking a little, but I thought while I'm sitting here, we're just trying to let that pass. I thought what a good opportunity just to make a video. So that's what I'm doing. So let's just jump right in to 15 years ago. Before that and in college, I had frequent bladder infections, really bad, where I would be urinating blood and stuff. And when I was diagnosed, I was in my early to mid 20s. And I was engaged, and we'd been together for a number of years. And my urine, when they do the UA and they look for the bacteria and blood and stuff, I was having the symptoms of a urinary tract infection repeatedly, like nonstop. And my urinalysis kept coming back clean, that I had no infection. And my doctor was an internal medicine doctor, and he was really confused. And actually, one day he called me into his office after another one of my UAs came back clean, and he said, your urinalysis are clean, so my assumption is that you have some sort of STD. And I thought, oh my God. Of course, he's a doctor. I'm young. I was just starting my career in the medical field. I had no idea that, he was completely off base. So I go home that night and confront my then fiance and start a war, because I'm like, who are you cheating on me with? And you gave me an STD and blah. And it was pretty awful. So they ended up testing me for a bunch of STDs, obviously, and those all came back clean. And so my doctor was really dumbfounded and sent me to a urologist. And I'm fat, dumb, and happy going to the urologist. They're like, oh, we're going to do this test on you to see if you have interstitial cystitis, because we suspect that's what you have. And 15 years ago, they didn't know as much as they know about interstitial cystitis. They didn't really have any good techniques for testing the bladder, so they did this barbaric test called potassium insulation test. Oh my God, I had no idea what it was in for. So I go there, like I said, fat, dumb, and happy, and lay on the table, and they insert this catheter into my bladder and immediately start to fill it with potassium. I was in so much pain instantly that I just about leaped off the table. It was absolutely horrendous. I thought I was going to die. And they made me lay there and hold that in my bladder for a long period of time. I don't remember exactly how long, but it seemed like forever. Maybe it was only a few minutes, but it seemed like a lifetime. So I had taken off work just to go to this appointment and go back to work. I go back to work in god-awful pain, white as a sheet, can barely verbalize anything because I'm in so much pain. And my manager looked at me and she's like, what happened to you? You need to go home. So I went home that day and rested. And so then they said, yeah, when I was at the urologist, they said, you are definitely have interstitial cystitis. And nobody really knew a lot about it then. So I wanted a second opinion. So I decided to trot my butt off to Mayo. and thinking that Mayo was the best place possible for somebody like me with a disease that nobody really understood to go, because they're like the gods in the medical community. And so I went there. I spent a week there having torturous tests after torturous tests. This one test, they made you sit in the middle of this room on this weird looking toilet, and they drop a screen in front of you, it wasn't like a TV, it was more like a movie screen, and they display a waterfall on it, and then they make you listen to water rushing or water falling or something like that to stimulate you to have to go to the bathroom. So you're in the middle of this gigantic room, and everybody leaves, and they say, okay, now pee. Oh, okay, right. So I sat there forever trying to work up the courage to pee in this horrible situation I found myself in. And, well, I eventually did, but it was, ugh. And then they took these x-rays, and they put these 10-pound weights on your kidneys, and do all this horrible stuff. And so I was there for a week. And after a week of being at Mayo, okay, I don't know if you've ever been to Mayo, but they start you with an initial appointment, and they go from there. And from that appointment, they send you to another appointment. And from that appointment, they make you 2 more appointments. And you keep going. So you could be going for an indefinite amount of time. There is no just one and done and you see a doctor and it's all over. They just kept testing me and testing me. And they told me, no, you don't have interstitial cystitis. We don't think you do, but we want to do some more tests. And I tell you what, after being there a week, my son was very little. He was a toddler. I said, forget this. I am going home. You people are freaking useless, and all you're doing is torturing me. And I can't spend any more money sitting in a hotel where is Minneapolis? Oh, that's just besides the point. Or Mayo. Mayo is in Rochester, Minnesota. And I was living in Green Bay. So that was quite the hike. So I needed to get back to my son and my life and my job. So I just kind of left it at that. And just dealt with the pain. And I tell you, what it felt like at the time was like having a bladder infection 24/7. If you ever had a bladder infection, you know what I'm talking about. Except it's a really bad one. It's not just, I don't know if there's a good bladder infection or, worse, if there's a scale, but if there's a scale, it's the worst thing you've ever experienced. So shortly after that experience, my fiance and I broke up, and I moved to Minocqua. And I saw a urologist there, and I saw a urologist in Wausau, Wisconsin. This is all in Wisconsin, by the way, for those of you I'm sure don't. If you're not from Wisconsin, you wouldn't know this. And they were like, I don't know if you have interstitial cystitis or not, because you don't have Hunter's ulcers. Back then, they would only tell you had interstitial cystitis if you had these ulcers in your bladder called Hunter's ulcers. So, interstitial cystitis, for those of you that don't know, is a disease of the bladder where you're lacking a lining to your bladder to protect the tissue in your bladder from the acidity in urine. So, imagine what that feels like. Shoot some vinegar up your nose. Just try it. Don't try it. I'm just kidding. But that's what it feels like. It's like putting salt on a cut or bleach or anything like that. It hurts. And there's a lot of frequency, and you will have bladder spasms, and you'll think, oh my God, I have to go to the bathroom so bad. And you run to the bathroom, and your bladder's sitting there squeezing like you're urinating, and nothing is coming out. And that is the most painful thing in the world. Eventually, years later, I have trained my mind to ignore those signals. And I always make sure that I actually have urine in my bladder before I go to the bathroom. How do I know that? I base it on the amount of water I'm drinking, because for somebody with IC, interstitial cystitis is often referred to as IC, by the way. Water is your lifeline. You've got to drink tons of water because it dilutes your urine and it's not as acidic and it doesn't hurt your bladder as much. Okay, so anyway, I digress. Let's go back. So I'm in Minocqua, seeing a urologist. He doesn't know what's going on with me. I go to Wausau, Wisconsin, and I see a urologist. So they decided to put me on meds like Ditropan. And Ditropan is for people with overactive bladders. They don't have IC. Their bladders just make them pee very, very frequently. So what happened when they decided to put me on these drugs was that my bladder went into retention and I couldn't urinate. So I had to learn in a doctor's office how to cath myself to empty my bladder. Talk about embarrassing. So you're sitting on exam table in an exam room, and you're sitting, you know, like this, naked, and you're with a nurse, and the nurse inserts a catheter. Okay, so they insert a catheter, and you have to watch, and okay, so can you imagine how humiliating that is? Okay, it was awful. So then you had to do it, and they show you how to do it, and whatever. And so I had to carry around with me at all times brain fog, lube, and catheters. And I don't know how I managed to work, but I did. Probably because I was young and could have put up with a lot. But I would carry my catheters with me at work. I'd have to go in the bathroom and cath myself at work. I was still socially active, like crazy. I mean, I'm in my mid-20s, you know. In my mid-20s, was I in my mid-20s? I think a couple of years progressed here, and I think I was in my later 20s. Yeah, I was in my later 20s. By the time that I got all these medicines that I had to carry around catheters. And so I would, if you're not from Wisconsin, you probably won't know that the state pastime is drinking and bar hopping and things like that. So I was a heavy drinker. Party girl all the way. I'd carry my catheters, my lube, because you have to lube the catheter. I probably didn't explain that. You can't just ram it in your urethra without some kind of lubricant. But it was extremely painful because part of the disease irritates your urethra too. So when I was working, you know, you'd have to sit in an office chair and sit at a desk. And I couldn't just sit flat in an office chair. I could not have the weight of my body sitting on my pelvic region and have anything touching my urethra because it was so ungodly painful. So I would just like lean over on one side, put my foot underneath, you know, my one butt cheek, and kind of just like prop myself like that all day at work so that I didn't have to sit on my urethra. Now, many years later, they make special cushions for you to sit on so that you're not touching anything to your urethra or your pelvic region. Because IC not only affects your bladder and urethra, it also causes what's in some cases what is called vulvodynia, and that's pain and irritation in the pelvic region. I also suffer from that. So I do have a cushion, and I do use it now. I haven't had to lately because I've been very careful about my diet. On IC, you have to follow a low acid diet. You know, you have to be careful of things like tea, coffee, acidic fruit, you know, more acidic drinks, tomatoes, anything that's acidic, you have to be so careful of, because that will cause your bladder to just go crazy. And so I've been very careful about that lately. I, unlike a lot of people, can get away with an occasional cup of tea and an occasional cup of coffee, and I will get just a little bit of pain if I eat tomatoes, because I love tomatoes. And let's just face it, sometimes you just want some of the things that you like, and it's very hard when somebody tells you that you can't eat this stuff for the rest of your life. I will get into a compounding factor to that, and why I have a little bit of trouble following my IC diet, and that's because I have celiac disease, and I can't eat anything with gluten, rye, barley, or oats, unless they're gluten-free oats. So I'll get into that. I'll make another video about my journey with celiac disease, and actually it affects my whole family, and including my son. He was diagnosed when he was 5. Okay, so anyway, back to interstitial cystitis. So finally I find a doctor, and enough time has gone by where they realized that, after doing more research, that you don't have to have Hunter's ulcers or ulcers in your bladder to have interstitial cystitis. So finally some doctor said, yeah, you've had interstitial cystitis this whole time, and you know, this is what's wrong with you. So can you imagine, for all of those years, so that spanned about 8 years, I went through doctors misdiagnosing me, treating me for things that I didn't have, making my symptoms worse, putting my bladder into retention. I get so angry. See, I did not want to make this video and talk about this stuff going that far back, because to me it's very traumatic, and it's hard to bring up, and it's hard to talk about how you bounce from doctor to doctor who can't help you, who's making things worse, who basically thinks that you're crazy, or you just have STDs, like that one doctor told me. They treat you like a total piece of garbage because they can't figure out what's wrong with you, and then they don't want anything to do with you because you're too difficult. They just want you to be simple, walk in the door, give you diagnosis, give you some medicine, and walk out the door, so they don't have to actually think. Because in the medical community today, it is not about quality anymore. It's about quantity. Excuse me, I need a tissue. I got a little teary-eyed, and now I'm having a little moisture problem. It's about the almighty dollar. So there are doctors out there who genuinely care about their patients and will take the time with them, and will sympathize and empathize with you and take good care of you. Those doctors, I'm telling you, are few and far between, because I have seen hundreds of doctors. Since my move from Wisconsin to Arkansas 3.5 years ago, I have been to a load of doctors down here, and I have yet to find one who knows how to treat me, first of all, medically, and secondly, gives a shit about me. Excuse my language, but that's the case. You know, I have an internal medicine doctor now who is very knowledgeable about my diseases, but he has zero bedside manner, and he makes me feel like a pile of shit every time I go in there, like I'm some pain in the ass. Like, when he asks me how I'm doing, he really doesn't want to know how I'm doing. You know, if I go in there for one thing and I want to bring up something else just to run by him, he doesn't want to hear it. Someone's beeping in my house. Sorry. I don't know what it is. Can't be my phone. It's in my hand. And so I don't like going to him. So I avoid going to him because I don't like him. I don't like his personality. He treats me like total garbage. He's very short and curt and, you know, just doesn't care. Shows me no empathy, you know, whatsoever. So now we've established that, yes, I have IC, and now that I'm not being jerked around from doctor to doctor, I'm able to control my IC well. What happens with interstitial cystitis a lot is that you go through flares, ups and downs, where one day you might not hurt as bad, and then something stressful happens, and the stress affects your bladder. There's a lot of chemical reactions that go on in your bladder when you have interstitial cystitis, and stress makes some of those chemical reactions more prevalent. And so you'll go into a flare and you'll be in so much pain that you're bedridden. I actually was bedridden with interstitial cystitis when in about 2006 and part of 2007. I still managed to work, but anytime I was not at work, I was in bed. And no one could help me. I failed all the treatments for interstitial cystitis. There's very few. You can do okay, so another thing that goes along with interstitial cystitis is pelvic floor dysfunction. Pelvic floor dysfunction is where the pelvic floor muscles don't work properly. They spasm, they're too loose, they spasm, they're too loose. Okay, so I have that problem. So you can go to physical therapy for that. I went, and it was absolutely horrible after the first time I stopped going, because literally the physical therapist sticks their fingers up your vagina and messes around up there. And I was like, oh, hell no. This is not happening. No, thank you. As a last-ditch effort, also I failed the medications. I can't remember the medication off the top of my head. It's a brain fog side effect of Elmaron. It's the only medication right now that's, I believe, FDA approved for interstitial cystitis. There's a mast cell process that goes on in your bladder, and you can take like a Benadryl type medication to help slow that down. So that does help, but not for everybody. So as a last ditch effort, I decided that I was going to try brain fog again. The struggle is real with fibromyalgia and brain fog. Oh, you know where they stick the needles in? It's a Chinese thing. It'll come to me. Acupuncture. I decided to do acupuncture. And, oh my God. I went to acupuncture 2 to 3 times a week for about 6 months. And it totally changed my life. It actually put my interstitial cystitis into remission for a couple of years. And it didn't really bother me. I'm out of remission now. And my biggest problem, and for some reason, I do okay during the day. I still have frequency, but when it gets towards nighttime, my bladder starts to hurt, my pelvis starts to hurt, and that's when I have to be really careful with my mind and how often I go to the bathroom and to make sure that my bladder is full. So that's what I currently struggle with, and I will have flares that last for minutes, that last for hours, that last for days. But it just seems for some reason that at night it gets worse, and I don't have any explanation for it. And I wake up a billion times at night because of the frequency and urgency to go to the bathroom, so I lose a lot of sleep, and it keeps me awake. So I guess that really is my journey with interstitial cystitis. It's a really horrible disease. They have done research, and the quality of life for somebody with interstitial cystitis is equivalent to that of a person with cancer and cancer pain and somebody on dialysis. So if you know anything about that stuff, you know that's a pretty bad quality of life. I really feel for my fellow IC sisters